coming in as we're talking here.
I think we want to start off with. I think right now we want to start off with Vivien Thomas and our tribute, right?
Yeah, man. Let's get into it. Shout out to Nafi for pulling up on us. She says Russia is playing on my app. My alerts are on.
I'm telling you,
And she
it's her,
didn't get a
it's her phone.
notification.
It's her phone settings. Like you might have it on your app, but if you don't have it on your like on your phone, if your phone is set to do not disturb for your apps, then it's not gonna work.
Yeah.
But today we're gonna be talking about Vivien Thomas, and for Black History Month, I think me and Eric decided that we're gonna just focus on people in the medical field that have an expertise in some type of healthcare and brought about a drastic change in healthcare. And today we're gonna be talking about Vivien Thomas, who is somebody that me and Eric both follow very closely. But in addition to that, he has a very humbling story, and it talks about his story is ultimately the what it means to be the bigger person, because I don't think I could have been him in his day and age, doing what he was doing and accomplishing the things he was accomplishing and not getting recognized for it. You know, there's only so much about being humble or being upright or being this person of honor that I personally feel like I can handle, that I would have to push back. So a lot of our tributes go to this. But just a quick story, if you don't know who Vivien Thomas is. Vivien Thomas is basically known as the godfather of surgical technician. He should have been known as the godfather of the blue baby syndrome, but that was something that was ripped away from him that Eric will talk about in depth. But just a little bit, know about him. He's from he traditionally worked out of Vanderbilt, but he's most prominently known for working in John Hopkins. And I worked out in the Baltimore area for a little bit, so I had an opportunity to go out and actually check out this site, go to his old lab, and not only see his lab and where he practiced, but also have the benefit of meeting some of the students he taught. Dr. Paoni, who was a heart surgeon out in Lubbock, Texas, took tutelage under him and explained how important he was and how important it was for him to learn from someone like this, and how the discord of back then really caused people not to understand what was going on. So Eric will read a little excerpt, and we'll put all that information in the description about where you guys can read up on this person. But Eric, what you got on him, and you can push with that excerpt.
Well, if for people who don't know, I mean, we know we've had a lot of people just join the channel recently. Heero and I are both in the medical profession. And it's really near and dear to us. I mean, it's something that we've been in and for like Heero 10 years, me 8 years. He's just a prominent figure to us, and we're going to explain something like just a little bit of history, and then we'll get into the rest of the agenda for the night. So shout out to the people that are watching with us, and hopefully this is something that inspire you like it inspire Heero and I. So give me just 1 second. I'm pulling up that article, and then I think we got a few people coming in the chat too. So the chat is already getting active. Shout out to y'all. So without further ado, let's get into the story. So Dr. Vivien.
Go ahead, Eric.
So his name is Dr. Vivien Theodore Thomas. He was born in Lake Providence, Louisiana in 1910. He's the grandson of a slave. He went to Pearl High School in Nashville, graduated with honors in 1929. He ended up getting a lab assistant job in 1930 with Dr. Alfred Blaylock at Vanderbilt. He studied anatomy and physiology by Blaylock, and he ended up mastering complex surgical techniques and research methodology in an era when institutional racism was the norm. Thomas was classified and paid as a janitor, despite the fact that by the mid-1930s he was doing the work of a postdoctoral researcher in Blaylock's lab. He ended up doing groundbreaking research into the cause of hemorrhagic and traumatic shock, and eventually was able to go on to solve the issue of crush syndrome and saved a bunch of thousands of soldiers in the battlefield of World War II. Some fast forward, Blaylock eventually got offered to go to Johns Hopkins, and by 1940, Blaylock and Thomas were doing unheard of surgical research. And then eventually Blaylock was offered the chief of surgery position at Johns Hopkins in 1941. So Thomas and Vivien Thomas ended up coming with them. So we fast forward 2 years later, we get to the blue baby syndrome, and Thomas was charged with the task of creating the first blue baby-like condition in a dog. And the way that he was supposed to correct it was by means of pulmonary to subclavian anastomosis. Now, for y'all, if y'all don't know what anastomosis means, it's a fancy way of saying sewing vessels, blood vessels together, essentially, if that's the most simple way I could say it.
No, pretty much.
So, 2 years of laboratory work and some 200 dogs later, which would never be allowed today because people love their dogs.
He did get away with a lot.
Yeah, he ended up figuring it out. And then what happened was they had to convince the people at Johns Hopkins that it was a viable surgery, and they ended up being able to do it. So the first procedure was done in 1944. Vivien Thomas stood on a step stool behind Dr. Alfred Blaylock and literally whispered in his ear and talked him through the first surgery while dozens of physicians and residents and medical students all sat in the thing and watched. So they said Thomas's surgical technique included one he developed in 1946 for improving circulation in patients whose great vessels, the aorta and pulmonary artery, were transposed. A complex operation called an atrial septectomy. The procedure was executed so flawlessly by Thomas that Blaylock, upon examining nearly undetectable suture line, was prompted to remark, "Vivien, this looks like something the Lord made." Now, if you want to see a movie about this, that's actually the name of the movie, Something the Lord Has Made. That's the name of the movie. It's actually really good. It's a heartfelt movie, and it shows the grind of somebody who was really dedicated to their craft. Now, I know we got a lot of people. We got a lot of people in the comments who are very, very big in their careers and profession, and most of the people that rock with us got it out the mud. Shout out to Christian. Shout out to Nafi. We know y'all grind. We know y'all got it out the mud. Me and Heero got out the mud too. So this guy, after coming up with this, was still getting paid like a janitor. Shout out to Christian. He watched that movie. He liked the movie. I mean, it's a great movie, and it just talks about the struggles that people go through. And some of the world's most famous surgeons, that even people that are legend, and the Heero and myself, Dr. Dan Cooley, Dr. DeBakey, Frank and Rowena Spencer, Dr. Alice Hayler. We know all these. We're in the, we are in this field. We are literally 2 generations removed from these people. I mean, Heero and I are very, very close to this. But anyway, going on, there were some struggles that Dr. Vivien Thomas had to wrestle with, because the guy who was coaching and mentoring up also had to keep up appearances by, now you can't bring this guy to the party. Nah, if this guy comes to the party, he better have a tux on and carrying a tray. And
there's a lot of things. There's a lot that has to be said about, because like I was saying in the beginning of this, the reason why I couldn't have been a Vivien Thomas is because the balls you have to have in order for you to put saving lives over being respected. That's something that our forefathers had a lot of tolerance and patience, because he saved. And you have to also be innately aware. He wasn't out here being able to use this procedure to help people that look like him. All those babies were white. And it doesn't really matter the life that you're saving, but he didn't have the opportunity to bring this information to his own people. He didn't get an opportunity to teach this to his own people. And even with the opportunity to perform these procedures, he never got the credit he was owed. There were books written about this. There were procedures that were patented over this. There was equipment that was patented over this that he never saw a dime of. His family never saw a dime of. But there is an iron bus in the hallway next to a janitor's closet to be of some symbolic irony with his name and everything on it. And you would think after all he's done and all the doctors he's created, in the honorary system, in the era of the honorary system, he would receive an honorary plaque. And that wasn't something that even happened. He didn't even get an honorary doctor's degree. He was given a JD degree because of some fallacy in their thought process. Baldwin is a scumbag. Hopkins is a scumbag because they continue to degrade his name and use it to also amplify. Vanderbilt and Hopkins both have a fund foundation for this procedure. But luckily for us, or not even luckily, thank God that Vivien was able to install this mindset of being great in his children, and they've been able to prosper in the medical field. But it's really annoying to read about these stories and have somebody come up and say to me something absurd like, when I come to draw blood on a patient, oh, can the doctor be here to draw blood on a patient? And
I think that's everybody's visceral reaction, though. See, the thing that I take away from this story is, and I like what Christian said, that he says that's something you don't see too much nowadays. People willing to struggle without recognition, and I think that's what I take away from it. And I understand where you're coming from. It does suck to not be able for people to have a preconceived idea about what a physician looks like. At the end of the day, if you need your life saved, why in the heck does it matter who comes in and saves your life? And I that's the only thing I care about. I mean, the job that you and I do is thankless. We know exactly what we're doing directly affects somebody, and it's literally going to save somebody's life, and they will never see us ever. I don't know. I actually have a video that my organization did about me. If you go find me on Facebook, there's a video that my organization did about me, and I actually talk about this. It's like people like him, people like us live in the shadows. We do the work, but nobody ever knows that we do it. I said we live in the shadows, and a lot of people like this live in the shadows. They do all the work. They do all. I mean, and by the work, I mean there was a dirt road, and they had a hoe, and they just dug the road. They just dug the road, and paved it, all by themselves, without anybody knowing. And honestly, I say shout out to these physicians, because these physicians did not have to recognize him, but these are legendary physicians that even gave props to this dude. They wouldn't be who they were without that. Man. So, I mean, I think it's a great story because, yes, he did get an honorary doctorate, but it was an honorary doctor of laws rather than medical doctorate. He was also appointed to the faculty of Johns Hopkins Medical School as instructor of surgery, and he retired in 1979 and wrote an autobiography. He died November 26, 1985 from pancreatic cancer at 75. So, I mean, this guy is an absolute legend. I mean, this guy inspires Heero and I to do what we do, not just in the operating room, but on this podcast. I mean, right now, not that many people know who we are. We know why we're on here. We're really trying to give information to people from a different perspective than they normally wouldn't get it. You know, I mean, we are who we are, and we have the personality we have, and we look the way we look, and it doesn't matter. I mean, our goal is to identify with as many people as possible, regardless of where you come from, what you look like, who you go to bed with, what kind of clothes you decide to wear today. We don't care about any of that. Where can we find common ground, and where can we grow together? And learn about each other and really just identify with each other. So I'm glad that we get to identify with Dr. Vivien Thomas today, and I'm glad I get to identify with y'all in the chat and with my brother, who I love very much on this YouTube channel. So that's our tribute to the good doctor. May you rest in peace.
No, definitely. And I love you too, Eric. And more than anything, we love you guys for joining us, and we appreciate you guys joining us. But that's just been our take. That's our little tidbit into our tribute. We'll be doing this at least once a week. We'll be picking somebody to talk about in depth and give you guys a closer look into some of our heroes in the medical field that have inspired us to keep working in the healthcare industry. It's not an easy job, but nothing in life was easy, and our shoulders were built for it. So we appreciate you guys taking into that. You can find us on all major platforms as far as the podcast is concerned: Spotify, YouTube, Google, everywhere. There's nowhere you can't find us. And if that's too hard for you, right underneath my face, You can use my link tree and find all those links. If you want to get in contact with Eric, you can swim in the comment sections of the YouTube page, or you can hit him up on IG. Our podcast is our easiest way of finding us. Sometimes we do some impromptu, but we're always going to be live on Tuesday at night. Appreciate you guys joining us. Let's get to the next show.
Don't care who's wrong or right. I hope that in the side, slow it down and we can catch the vibe. But it's so hard to find through the daily grind. Been working overtime, and I'm sleep deprived. Shorty on my line and we fuss and fight. Seems like every night. Don't care who's wrong or right. I hope that in the sight, slow it down and we can catch the vibes.